Yeah, and I think it's now, well, I guess all the time there are a huge amount of startups in this arena, and I guess that the language and the experience you got out of that experience helps you being in touch with so many companies at the same time who are starting out and also growing and merging and IPOing and all that.
Well, I think part of the
So
experience, just to put it in a nutshell, whether you're a doctor, a nurse, a patient, an IT person, anybody, you can find a problem today. And even now, it's much easier to solve it. You can now press a button and build an online store, right? At the time, I had to hard code it and figure out how to do the credit card stuff. And it was very manual, but I knew the problem very well. I was the medical student who was frustrated by the high price of books. I knew what books we would buy. And I was contacted by friends at other medical schools and you get their personal lists of what they were reading. So, I think the best entrepreneurs are embedded in the problem space. In many cases in healthcare now, the best entrepreneurs are not doctors or biotech folks or medical devices. They're coming from ex-Google folks. A friend of mine I've gotten to know through the XPRIZE and running a rapid COVID testing XPRIZE was the founder of Grail. And Jeff Huber, who was a VP at Google, whose wife unfortunately died young of colon cancer when it was not diagnosed early. And from that energy, he kind of co-founded with Illumina, which now owns the company, Grail. And he had a lot of technical and other expertise, but used that passion and found partners to build a very powerful platform. And now you can, as of today, you can get your own blood biopsy to test for early cancers in many regards. So bottom line, when you're an entrepreneur in any sense, or even not an entrepreneur, but you see a problem, there's new ways to build solutions. You don't have to start the company yourself. You can find the college student down the street who knows how to build the app. You can find partners to offsource and build for you. I've recently, for example, another pain point I've been trying to solve is in digital health, which is something I've been involved in. There's lots of new solutions out there, from wearables and apps and AI platforms and combinations of AI meets devices and beyond. And there's just so much out there. I'm always surprised how many doctors and nurses don't know about the existing solutions. It might be the AliveCore EKG to manage AFib, or an app to help manage depression, or a platform for diabetes, et cetera. So I was lucky to get the domain Digital.Health, which is an easy to remember domain name. I was helping the .health team, and I've now built that as a sort of a digital health formulary. So if you go to Digital.Health, it's got resources to learn about regulatory and news and FDA, but also has a database where you can search for diabetes, or AFib, or mental health, or global health, and find some of the solutions that are out there, and create a formulary and start even to prescribe those to your patients. And I built a very early version myself on Squarespace, but then later I hired a little dev team and and a designer. Now we've built the more proper space, and now it's hopefully going to take off. We've just basically launched it. But that's an example of, you don't need to have a $1 million of investment or a whole big team that's full time. You can now on Odesk or Fiverr or with friends and family build a solution pretty quickly, at least get a minimal viable product out there and see if it has some legs.
yeah, and they say that the next big industry to be disrupted is the health industry, and that it's not going to get disrupted by the inside people, meaning the doctors and physicians, but basically outsiders from other fields and industries. Is that your opinion too? And are you seeing this in all the conferences and companies you consult?
Well, I just gave you that one example of Grail being started by a non-medical person, but a lot of intelligence and connections and insights. But in general, yes, a lot of the newer needle mover companies come from folks from outside of healthcare, because the convergence of technologies and solutions comes from AI and blockchain and gaming and VR and 3D printing and nanotech and synthetic biology. And so it's not the usual clinician who is usually overtasked and just has no entrepreneurial training in medical school. And by the way, since I was a medical student, now there are many folks getting MDs and MBAs. Not that you need to have an MBA to be a good entrepreneur, but it gives you some more fundamentals for how businesses work and are grown. So I think it's often a combination of having someone who is a bit of an outsider view, who sees a pain point, and then smartly combining forces with folks who understand the clinical space well, because you might have a great invention, but you may have very little insight how that's going to work, not just for the patient, but for the nurse and the hospital system and the insurance companies and the payers and the regulators. And so it's a team sport. And so the best combinations have kind of beginner's mind, new mindsets, new technologies, with folks who have some understanding about how healthcare works, which might be very different in Mexico City versus New York versus in the NHS versus, in Asia. So many healthcare systems, and that means solutions don't often work in every market.